Yeah, welcome to our final presentation for this course. You probably noticed that I changed the cover slide by including different skin lesions. As of now, I'm very confident that you have developed advanced skills in your differential diagnosis. Uh, this is a very important component because most graduates have issues differentiating these common rashes, and it develops with time. But as we focus on skin, hair, and nails, mainly integumentary system, I want you to be able to tell the differences between these rashes and how they help you form an accurate differential diagnosis. As you are already aware, the skin is the largest organ of the body, comprising of the outer component, outer part, the epidermis, and then the dermis, which is the middle part, and then subcutaneous tissues. But we will not spend much of the time into this anatomy and physiology. But we are looking at how, for example, the sweat glands help in regulating body temperature and protecting against pathogens, for example. And so, as you do your health history, it's very important to inquire about any new or changing lesions that the patient might have noticed in rashes and itching, and pay close attention to when patient reports, for example, sudden hair loss, or if they notice uh, any changes in their nail beds, for example, because those may indicate systemic issues. It's very important to be able to describe the skin lesions based on the ABCDE mnemonic. For example, when you're documenting a lesion, you must assess asymmetry, border regularity, color variation, and diameter. Is it evolving? Is it elevated from to palpation? All of those descriptions are very important and they should appear in your documentation. So here are some of the primary lesions, like macula that I mentioned here, or a patch that you might notice, plaque or nodules, how they present differently. For example, bulla, you see it here, or vesicles. This helps you to tell the difference between these lesions, and that's something I also mentioned. I gave you I showed you an image of rashes and how they might present. And for example, the nodules and pustules indicate like a deeper or fluid field. You see them here, the nodules right here, uh, fluid field, and vesicles and bullae, for example, are blister like. And wheals, what happens to the wheals on the far right side? Those are typical of allergic reactions, presenting as transient or raised lesions, raised areas. Sorry. So this is also a continuity of some of the benign lesions. Be able to tell the difference between benign lesions and lacerations. If you look on the right side, you can see those are lacerations like actinic keratosis or squamous cell carcinomas. These are, you have to pay more attention to these ones because they need follow up with the dermatologist. In primary care, when we see these lesions, most of the times we refer the patient to a dermatologist or oncologist if they have an established diagnosis. Some providers, if you are trained, you can do a patch biopsy and then send it to the lab for deeper analysis. but that's up to you. It depends on how on the relationship you also created with the patient if you had them for years and you know them very well. But as long as you are trained, or you can do patch biopsies and then send it to the lab for diagnosis. And also another important component is the distribution of the skin lesions, which can often point toward a specific diagnosis. For example, psoriasis commonly affects the extensor surfaces. For example, vitiligo presents as depigmented patches. Discoid lupus often appears on sun-exposed areas. So this distribution is very important to help you to direct you to the right diagnosis. Configuration, it's another important, which refers to the shape and arrangement of the regions. So some linear, for example, linear lesions follow a line, as you already see over there on the slide. Anura are ring shaped, and mamura, for example, or discoid, are coin shaped. So the target, or this one on the left side, or iris, those look like bull's eye or target or bull's eye lesions, which are classic for erythema. And so you can see also we have this one, serpiginous, which are like snake-like. That serpiginous comes from serpent or snake, often seen in fungal or parasitic infections. So a very thorough or meticulous physical examination requires lighting. That's very important. Use of dermoscope for a closer inspection. And you will notice in most primary care practice, they have a dermoscope that you can use. So ensure the patient is examined in both seated and standing positions, as well as spine. Integrate this exam into the overall physical assessment, which is very uh, helpful, and take time to teach the patient about their routine self-examinations of the skin. And some special circumstances that you may notice or come across, circumstances which require tailored assessment techniques. For example, hair loss. In that case, look for patterns and scalp health. For bedbound patients, for example, it's recommended to inspect pressure points and skin folds, as these individuals may have higher risk of they're at higher risk for skin breakdown and pressure injuries or pressure ulcers. So that now that we talked about pressure injury, this is how the staging has been revised. I know you covered this in your fundamentals class, but you can see how it was revised from stage 1 intact, still from stage 4 full thickness, but also keep in mind about unstageable and deep tissue. Unstageable injuries, for example, are obscured by that slow, and deep tissue injuries present as persistent purple discoloration, while unstageable will be obscured by the eschar. When you are recording your findings, keep in mind that you need to document the number and size of lesions, their color and their texture. Use that A, B, C, D, E to help you document them correctly. So some of the risk factors for melanoma, most of the times it's but also sun exposure, family history, and you know, other non-major or minor risk factors of single red hair, childhood have sunburns, but that's a major risk factor. UV radiation exposure, also immunosuppression from HIV or chemo. Those are other important risk factors. So I mentioned A, B, C, D, E before, but this is a visual that can help you to differentiate those skin lesions or even document the lesions based on the A, B, C, D, E. All right, and this is our final slide, which focuses on health promotion and prevention. What would you educate your patient to prevent, for example, skin cancer? It's about avoiding UV radiation from tanning beds or excessive sun exposure, because we talked about this as being one of the common risk factors. And for some professions, for example, landscapers, those patients may have been exposed to the sun for a long time, but it's never too late to teach them about the daily use of broad spectrum, for example, sunscreen, and then also regular professional skin screenings to detect any suspicious lesions as early as possible. It's never too late for any patient to teach them about health prevention and promotion. This is the prevention and health promotion. Thank you. If you have any questions, don't hesitate to reach out to me. I'm here for you.